All right. Assalamu alaikum. Peace and blessings, good people. I want to, first of all, welcome you all. I'm Dr. Aisha Elamine, and I serve as the chair of the Taqwa Committee at Masjid Al Taqwa, not the Taqwa Committee, the Talim Committee at Masjid Al Taqwa. And I have the pleasure of welcoming you on behalf of the resident Imam Tariq Elamine, and the Talim Committee, which is myself, Dr. Lionel Allen, Dr. Gloria Bashir, and Sister Rashida Fitzpatrick. Um, we, as you may have noticed, we are recording today. This recording, along with the rest of our Talims and Kubas, can all be found on Masjid Al Taqwa's YouTube page. So please, if you have not subscribed, please do so. I have the distinct pleasure of introducing our topic for today, which is caregiving and caring for the caregivers by the Muslim Health Consortium. And I'll hand it over to Imam Ramadan, Dr. Ramadan, because he doesn't need an introduction as our founding Imam, and just a beloved member of our community and leader in our community. And so if you can introduce the rest of the Muslim Health Consortium and get us started, the floor is yours.
Assalamu alaikum. Thank you very much, Sister Aisha. It is indeed my pleasure to introduce the Muslim Health Consortium and the members who will be presenting today. But before going into our presentation, I'd like to give you a little background on the Muslim Health Consortium, what it is and who we are and what we do. The Muslim Health Consortium was organized at the onset of COVID. And at the time that we came together, COVID was just a concern. It hadn't spread. The potential was certainly there, and that was seen, but it was a virus of concern. And we began articles, regular articles in Muslim Journal, that this should be something that we watched and what we should do as a community. And we kept those articles up for a couple of years. The concept of the Muslim Health Consortium goes back to the Sikh committee that was established by Imam Warithuddin Muhammad over 45 years ago, when he set up the Masjid committee system. And the Sikh committee was one of the original ones, and it has since evolved from that concept. Right now, the Muslim Health Consortium represents Muslims in our community, professionals in healthcare. And this is from doctors, nurses, technicians, teachers, health administrators, scientists, and we come together, and we hope that we have become a trusted voice within our community. At the time, that was needed and being called for because there was so much misinformation and historic suspiciousness of our healthcare system, and understandably so. So we saw ourselves fitting in that space and bringing the information that was evidence-based and researched by us, and from the point of view from a Muslim perspective, and making recommendations as to what we should do. And these are the sort of things that we did throughout COVID. Our work is to research topics, write articles, do webinars. We do monthly programs at the Mosque Cares on first Sunday. We do Lifeline, and occasionally we do study Al-Islam presentations. We have a current topic, current project, and it was an assignment that I was given 45 years ago by Imam W.D. Muhammad, and that was to update How to Eat to Live. And thank Allah, I think we now have the individuals in place and the perspective and the benefit of his tafsir and insight to give that major task justice, inshallah. So today we have with us two members of the Muslim Health Consortium. We have Sister Sharon Abdullah, and she is a retired respiratory technician, and she is also an instructor for the American Heart Association. She is a member of, I think, the Health and Wellness Committee at Masjid Muhammad in the nation's masjid in Washington, D.C. And she'll be giving our PowerPoint presentation. And we have also our brother Ron Foster, and we consider him our scientist. He is a retired researcher at Eli Lilly and also a school teacher, and he's in the masjid in Houston. So with that introduction, we will move right into our topic. And this month, if you weren't aware, is National Caregivers Month. November is National Caregivers Month. Hence our topic, caregiving to others and caring for the caregiver. And we would like to say at the beginning that we pray that Allah give us all the heart of a caregiver. A caregiver's sacrificing can be from a form of charity and worship. We have to say Allah knows best. We pray Allah to soften our hearts and to strengthen our backs for the caregiving tasks that we may have to encounter, whatever they may be. And it may be from something as small as putting a Band-Aid on someone's cut finger, all the way up to long-term care of a parent with dementia. And we encourage all of us to remember that our reward is with our Lord. And for us, caregiving is for Allah's sake and for the love of our fellow man. Indeed, a smile, a kind word, listening to a distressed person can be a form of caregiving. We pray that Allah accepts our caregiving as a charity from us. And you remember the hadith, and I'm paraphrasing it, when Allah asks, when I was sick, you didn't visit me. And the reply was, how can you be sick? How can I visit you? And the response was that had you gone there, you would have found me there. So, alhamdulillah, there's a lot in that. And we always keep in mind that people don't care how much you know until they know how much you care. So a little bit about caregiving, the institution. This care, the caregiving that goes on voluntarily, if it were paid for, would cost about $470 billion a year if you had to purchase it. So the government and society is getting off cheap because we care for our own families, our own kin, those that that we know. So a lot of caregiving and the time spent is invested into that. So it's caregiving becomes more important as our population ages. And caregiving is an important public health issue because it affects the quality of life for millions of individuals. They could not do or exist or have a good quality of life if someone didn't invest the time in giving care to them. So let's look momentarily at the caregiving in the African American community. Over half of us feel that we don't have a choice when it comes to being a caregiver. It's like taking care of one of our own. Might be a spouse, mom or dad, or even both of them. A disabled child who's become an adult, and they may have required lifelong caregiving from a family member. And it might involve tasks such as bathing, dressing, remembering medications, doctor visits, exercising with them. So families ask, or a person asks, if I don't care for my relative, who else is going to do it? So a lot of times we feel like we're on the spot. And as we know, a lot of family politics can be involved in that decision. Oftentimes, it falls on the responsibility of one family member for the caregiving of mom or dad or sickness or chronic illness, care for that person. And generally, it's the female of the family. And she feels that it's like giving back to someone who's took care of me when I was small. In our community, in the African American community, often we have some burdensome caregiving situations. We see that the caregiver tends to be younger, single. That person himself or herself may be in poor health. And they oftentimes have to balance caregiving with a full-time job and even raising family members of their own. So caregiving tasks are not small. And the pandemic added to this. Many of the jobs that we had were essential workers requiring transportation or public transportation. And then we were still facing caregiving tasks and raising the family. Can you imagine the difficulty of a person trying to navigate that? So situations that require caregiving, and it can be things from learning about a cancer diagnosis, chronic illnesses such as stroke, heart attack, multiple sclerosis, severe arthritis, chronic renal failure, and certainly Alzheimer's and other dementias. And we have to remember that the person with Alzheimer's or dementias can have all of those other illnesses too, or they might be in good health otherwise, but have the problem with memory or thought. So caregiving situations can occur even when you're in good health. Accidents and falls can result in the needing of care. And then there are lifelong disabilities. And then there are the physical problems that have come along with normal aging. So, as we said, it can be required physical, mental, spiritual, financial, and institutional caregiving. And I think at this point, I'm going to hold right there and turn this presentation into the hands of my colleagues who will go deeper into some aspects that we've touched on now. So thank you, Sister Sharon.
Alhamdulillah. And assalamu alaikum to the audience. And Dr. Ramadan, feel so blessed to be part of this opportunity to actually share our presentation on caregiver. And I imagine, and to the audience of Masjid Al-Taqwa, I imagine if we took a poll right now, most of your hands would go up because you've experienced some form of caregiving. So inshallah, if you haven't, you will, as your lifespan continues to unfold, you will experience caregiving. Just a little bit also about my background. When I was a respiratory therapist, I became a manager, and I was afforded the opportunity to have actually studies in the Masters of Healthcare Administration. So I learned about the continuum of care. You know, you're in a hospital, and then you may not be able to go home, and then you go into rehab. Then you still may not have to be able to go home, and then you go into skilled nursing, and then there's hospice at the end of life. So, inshallah, we are going to show you the PowerPoint on caregiving. So I'm going to actually exit my full screen. Okay, and okay, and what I want to do is actually want to, okay, so I have that on the desktop. I'm gonna share my screen. Okay.
Yep.
Alhamdulillah. Excellent. And I will put it in basically the slideshow.
You're all set.
Okay. Are we good?
Yep, you're good to go.
Alhamdulillah. So again, Dr. Ramadan mentioned that November is National Caregiving Month, and we wanted to highlight this. There's several healthcare initiatives for November, but this was something we really felt that we needed to express and review because that the information is very vital to our communities, inshallah. So, what is a caregiver? A caregiver is an individual who provides care to someone who has a physical or mental health condition or who is chronically ill or frail. Now, caregivers may be spouses, adult children, in-laws, parents, siblings, extended family members, friends, neighbors, or a family of choice. Okay, so what is caregiving? Caregiving is providing care for the daily needs of someone that is unable to care for themselves. So the care may include addressing the physical and emotional needs of someone that requires continuous support and attention. The individual could be a loved one or a friend. And as Dr. Ramadan alluded to, most caregiving occurs in the home. And as we provide this PowerPoint to you, I'm working with my family because the oldest sibling needs caregiving at this time, inshallah. Okay, so what do caregivers do? They help with finances, grocery shopping, wellness appointments, giving medications, helping with feeding someone, help with bathing, grooming, and dressing. And we call that the activities of daily living. So most caregivers are family members and friends who give care naturally. Why? Because they love the person. But as the next slide shows, but that care may be required for months and years. It may take an emotional, physical, and financial toll on our caregiving families. So let's talk about some caregiver statistics. So across the United States, the estimated amount of the cost is there's 38 million people and about 11.5% of the population that are taking care of loved ones. And was of this year, 2023. So that care will total nearly 36 billion hours with a value of nearly 600 billion. And the source was the AARP, or the American Association for Retired Persons. Okay, and Dr. Ramadan alluded to caregiving in African Americans. We know our history. We know that we love our family members. We just have a heart for caring. So basically, as he also mentioned, it could become more burdensome, depending on our financial structure. You know, how much finances do we have to share? But we still find it hard to make that happen. And we find that so we have more burdensome situations than non-Hispanic whites and now Asian counterparts. And of course, Dr. Ramadan alluded to the fact that we may be younger. We begin to have children sometimes younger, so we find ourselves caregiving a little earlier in life than others. And some are unmarried, have poor health themselves, and they frequently are working, as Dr. Ramadan alluded to. Okay, our veterans, thank you for your service. Yesterday was Veterans Day. And so, in fact, I'm married to a veteran. So 2 caregiver support programs. So what's the difference? So you have the Program of General Caregiver Support Services, known as the PGCSS. And that's the core of the VA's caregiver support system. It provides peer support, mentoring, skills, training, and coaching, telephone support, online programs, and referrals to available resources for caregivers of veterans. And then you have the Program for Comprehensive Assistance for Family Caregivers, known as the PCAFC. Now, in order to take part in this program, you have to be part of the Department of Veterans Administrations. You need to be in the system prior to partaking of this program. All right, so family caregiving, just some more numbers. We did see the $600 billion of unpaid care across the US, but this term here, valuing the invaluable. Caregiving is invaluable. You do it because it's in your heart to do it, and that love is there. Everyone can't be a caregiver. Everyone cannot be a caregiver. And as you go through these family dynamics, then you find out who is best and suitable for caregiving. So the impacts of caregiving. So there are physical and mental healthcare impacts, and they're well documented. So in 2023, the AARP found that 40% of all caregivers talk about the emotional stress of juggling caregiving and working as their biggest challenge. So that financial implications of leaving the workforce, Dr. Ramadan alluded to that. Basically, you're getting Social Security benefits, many of you, and those lifetime earnings and retirement savings may be reduced. And if a caregiver chooses to later re-enter, you may have to go back into the workforce, then you often face additional issues such as you have gaps in your resume that you need to fill. Okay, and then we talk about dementia care. So we're helping our loved ones and learning safe tips for meeting the unique challenges of caring for someone with dementia or Alzheimer's. And most challenging, we're learning how to deal with the cognitive changes that occur with our loved ones, the erratic behavior and the personality changes. Now, in those early stages, when the impairments may be relatively minor, we need to make the most of that time together. And we need to encourage our loved ones to join us in developing a care plan for them, inshallah. All right, so what is the CARE Act? I'm sure many of you who do subscribe to the AARP magazine or go online, you've seen the progress of the CARE Act. So what is the CARE Act, and what do these acronyms stand for? So the C is for caregiver, A is for advise, R is for record, and E is for enable. So now it's law in 40 states and territories. So the policymakers, they're recognizing now that family caregivers need support to perform the medical and the nursing tasks that they're faced at home after a family member or friend is discharged from the hospital. So once again, for all of you seasoned caregivers out there, you are aware of the discharge planning and how that unfolds, and the plan for once your loved one is discharged from acute care or the hospital or any other facility of continuum care. All right, so family caregiving. As I said, we all probably can raise our hands to that. So how to keep resentment? First of all, you have faith, la ilaha illallah. But how do you keep your resentment and anger at bay when caregiving is difficult, and finding the patient is critical when stress levels do skyrocket? All right. So if there are any first-time caregivers out there, just 5 tips. Start the conversation. Look for an opening. Try to basically don't avoid the subject of money and finances. Listen and respect the loved one's desires and bring others into the conversation. Teamwork, form a team. Go deep and wide. Ask those that near to you and also far away that are friends and other family members to help with tasks. Decide who's going to be in charge and find a mediator. Time to make a plan, determine the roles, be honest with yourself, and put it in writing. Find the best ways to communicate. And when you care for your loved one, advocate for yourself. You keep your home safe and stay organized. And I have files and files and files that I'm developing for my brother. So care for yourself. Self-care to avoid high stress levels, becoming depressed, and other health-related problems as we age. So because we're still aging as well. And be prepared to go it alone. But as I say as the CPR instructor, when you start doing compressions, you need to be on 911 on your cell phone or look somebody in the eye and say, go call 911 and come back with the AED, because sooner or later, your CPR is going to become ineffective. All right, caregiver burnout. It does happen unless you fortify yourself. So tips to preventing and managing our stresses. We want to recognize the causes and symptoms so that we can get the help we need. And we have a 2-minute YouTube video on how to do that, inshallah.
Most people have no clue that in 2023, the best way to make money on Amazon is not with physical products. It's Amazon's other company, Audible. Audible pays me $8,000 to $10,000.
Feel so guilty when I take even 10 minutes for myself.
I lie awake most nights worrying about my sister. I'm so tired during the day. I find myself getting upset by simple things like when my sister calls to tell me how she's doing. I love her so much and I should be glad she's calling, but instead I just feel overwhelmed.
I'm supporting my friend through the ups and downs of this treatment journey, but I feel exhausted and stressed most days too. How am I supposed to help when I feel this way?
I have so much weighing on me. I work, take care of my kids, and help my mom when her mental illness gets bad. No one understands what I'm going through. These are the voices of people who are providing support to loved ones with mental illness. So often when we provide care for others, we forget to take care of ourselves too. This can lead to burnout, which is caused by physical, emotional, and mental exhaustion. Some signs of burnout are feeling overwhelmed or stressed out and having constant negative self-talk. If you aren't taking care of yourself, it can be difficult to help someone else. Proper self-care is important to ensure you stay healthy and have a good mindset to continue to provide the necessary support to others without burning out from exhaustion and stress. Here are some things you can do to practice good self-care. Move your body. Make sure to move your body every day. Exercise under the direction of your physician is great, but even things like dancing, housework, gardening, or simply going for a walk can help. When you start to feel overwhelmed, sometimes changing your environment for just a little bit can ease some of the stress.
I've just been so stressed out. Last week, I had a friend come over and help me out just so I could go for a walk. I felt much calmer when I came home.
You don't have to physically leave to take some time away from stress. Sometimes just taking a few minutes to focus on your breathing can help you feel better and reduce your stress. Yoga and meditation are also great activities that use breathing exercises for self-care.
Last week, my dad was having a rough day. When he left his home and got in my car, I was really upset. I started doing some deep breathing exercises. After a few minutes, I felt so much better and I could refocus. Breathing helped to recenter myself before I drove away.
Follow a healthy diet. Eating a balanced diet and staying hydrated with water is just as important as any other self-care practice. Talk to your doctor about the right diet for you.
I didn't have time to cook every day, so I started to prepare meals ahead of time. It was a relief not to worry about what I was going to eat for each meal.
Sleep. With all the demands from daily life on top of being a caregiver, sleep can sometimes be hard to come by. Worrying can keep you up, tossing and turning. It is important to get a good night's sleep so that you feel rested, refreshed, and alert. If you are having difficulty sleeping, try to develop a schedule for your sleep. Make a bedtime routine and try to stick to it. Turn off electronics before getting into bed. Reducing caffeine before sleep can help as well. Finally, make your sleeping environment dark, cool, and comfortable.
I was on my phone too much before I went to bed. I started to put my phone away before I got into bed, and I found that I fell asleep peacefully. I've been feeling more rested lately.
Build a support network. Being a caregiver can be challenging at times, but building a dependable support network can have tremendous value for your own self-care. It's important to talk to other people, ask questions, or lean on others for emotional support.
My husband and I joined a support group in our area for other caregivers, just like us. It helps to talk to others who are going through the same issues we are. It makes us feel like we aren't alone in this, that if other men and women can support their loved ones with mental illness, we can too.
Practicing good self-care can be one of the most important things you do as a caregiver. Remember to take time for yourself, be kind to yourself, speak positively to yourself, and acknowledge that your situation can be tough no matter how much you care for the person you are supporting. It is not a weakness to ask for help and support. When you take care of yourself, you can better take care of those you love.
Alhamdulillah. Excellent, excellent, excellent. So we're going to come out of there, inshallah. So I hope that, inshallah, that was a benefit to caregivers out there. Okay, so let's talk about, inshallah, respite. You've heard it. If you're a caregiver, you've heard respite. So what is respite? It's a short period of rest or relief from something difficult. So caring for a loved one can be very difficult on a caregiver. Respite care provides temporary relief to a primary, that means you're out on first base, from the continuous support and care of a loved one who has a disability or medical condition. So a person who is paid to provide respite, those are some of the types. So you can have some that are paid, and of course, your family caregivers who are mostly unpaid. So these people who come into your home or into a facility that can provide personal care, they can be a healthcare professional, a nurse, an occupational or physical therapist, or other licensed clinical professionals. They can be homemakers or companionship providers. They may be employed, self-employed, or contracted to work in facilities or in the home. So the types of respite: formal, informal. Of course, we talked about in-home and out of the home if necessary. Respite options that exist in your location. So some may utilize an available bed if necessary in a healthcare facility. We talked about long-term care in nursing homes, skilled nursing facilities. For families who require extended respite options, they may want to go on vacations or something of that nature, and whose family members or friends requires that skilled care. Other programs may only offer time limited, just a few hours a day. And alhamdulillah, that does help. Just to share with my father-in-law, we did have an entity come in, a home health entity, just for 4 hours a day. And that helped because both my husband and myself were working at the time. All right, let's talk about these talks. Having those important family talks. Well, who should talk? Everybody. The parents, if they're still alive, the siblings, the spouses, family members, adult children, close friends, your personal physicians and doctors, the specialists, the case managers, and social workers. Well, when? Often. Face-to-face, on the phone, email, chat, messenger, Zoom, FaceTime, whatever you have. Continue that connection. And why? We don't want guesses when our loved one is no longer to communicate with us, their wishes. It helps us to avoid anxiety or arguments and anger. It prevents delaying that care, that important care or the task, and receiving the services that may be available to our loved one. All right, just briefly here, I was online looking for something for my brother, and there's a home health services checklist. And some of the items on there, just a few, is it Medicare or Medicaid certified? When you do reviews of it, what types of reviews do others, caregiver families, give this particular home service? What are the cultural challenges, language challenges? Once that home care provider comes into your home, research that and other things. And inshallah, this link will be at the end of the presentation for your resources. All right, so we're caring for our caregiver. We're wrapping it up. So you're making time for yourself. We're making our salats and prayer. We're meditating, dhikra. We're providing that diet they spoke about, and we're hydrating, water, and other types of hydration, sleep, and exercise, quality sleep, deep breathing, exercising, walking in nature. That's my favorite. Maintaining quality relationships. Those quality relationships will afford you that help because those are like-minded people who will come back and help and strengthen you when you need it. And don't forget to ask for help when needed from your family, friends, and community resources and healthcare providers. And there's another YouTube video. Do we have the time or should we just push it forward? Inshallah.
You have the time. We go until 2, so we have
Okay,
20.
alhamdulillah. All right, setting these boundaries, caregivers.
There's one simple vision hack anyone can use to improve vision, so you can say goodbye to your optometrist for good. Did you know that?
I've been taking care of my mother, who lives with me, for about 4 years now. Lately, I've been feeling distant. I know I've been very irritable towards her too. Why can't I seem to feel compassion for my mother anymore?
Can you relate to Alicia? So, you may be experiencing symptoms of compassion fatigue or burnout. First, you need to know that you are not alone. Burnout is a very common problem among caregivers. Second, although burnout can develop quickly, it can also be reversed. Let's talk more about burnout and what causes it. Most often, at the root of burnout are these two main factors: the caregiver's level of personal boundaries and the sense of guilt they may feel when saying no. So how can you set up healthy boundaries as a caregiver and avoid feeling bad about it? Let's look at 5 steps for building guilt-free boundaries in your caregiving relationship. The boundaries you create will differ by situation, but these steps can serve as a foundation for any kind of boundaries you decide to set up. 5 steps to building healthy boundaries. 1. Recognize how much you can help while retaining good mental and physical health. Overcommitting yourself to the point of burnout is not helpful to you or your loved one. Sometimes, even assisting with small tasks will meet your loved one's need without overwhelming you. 2. Spread the responsibility. Divide and manage your assigned tasks. For example, you might only be responsible for scheduling appointments or providing transportation to therapy, and others in the support network may be responsible for refilling medications. 3. When you're feeling guilty, remember that all your contributions as a caregiver are meaningful. Sticking to your established boundaries can reduce guilty feelings over time. 4. Balance caregiving with your other commitments. Engage in healthy activities. Limit your work to scheduled hours. Interact with friends and other family, and allow yourself time away from caregiving responsibilities. 5. Remember that you cannot be everything another person needs, and attempting this may make you feel less than. Set yourself up for success by offering specific care that is reasonable for you to give. With practice, you may be able to reduce the pressures that can cause burnout. Not all caregivers have friends or family who can share your caregiving responsibilities. If this is the case, reach out to the treatment team of the person you care for to find out about additional services and support for caregivers. If you are a part of a faith-based community, that may also be an option for providing support for yourself as a caregiver. Now that you have learned some steps for creating boundaries and finding support for your caregiver, let's see how Alicia used the same steps to create a healthy change in her life.
I'm not ashamed to admit I started to feel burdened by my caregiver responsibilities. My husband encouraged me to join a support group, and things slowly started to change. In group, someone talked about how it was okay to be clear about the things you could and could not do as a caregiver. That was the first time I considered having rules or boundaries about what I could do as a caregiver. Since I started to create clear boundaries, my relationship with my mom has improved.
Just like with Alicia, setting boundaries can help you to avoid burnout, which will enable you to provide better care. Remember, while changing your mindset and practice may be challenging at first, stick with it and don't give up. Regaining your sense of purpose and energy is worth the effort.
Okay, very good.
I would say that we're closer than the average mother-daughter.
Alhamdulillah. All right, so wrapping everything up. So everything Allah gives us is for a purpose. Everything Allah takes away from us is for a purpose. Every experience is for a purpose. Allah doesn't do anything without a purpose. Everything in your life had a purpose, even the pain. So alhamdulillah, we wrap it up with various resources for you to continue to research. And inshallah, I will stop the share and turn it back over to my other colleagues.
Brother Ron.
Yes, assalamu alaikum to my colleagues, and I also send my salams to the faithful, both in the audience and not in the audience, if you could pass it on. My talk today will be centered in a way that bridges the gap between what is theoretical, what is practical. And it's going to be done in the context of 2 elements. The first element will deal with the transfer of intergenerational wealth and its effect by caregiving scenarios, as well as the effect on the spouses of caregivers. Now, as I get into this, I would like to first apologize if I come off as cold or clinical or morbid or even cynical. I apologize for that, and I guess it'll seem like that because I sometimes lack the sufficient mastery over the English language to come up with the proper words to convey the message in a more humane, I guess you could use that word, way. Now, theoretically, it starts out when you're dealing with the caregiver and the caregiving situations. You have this nice, rosy picture. Everyone's sitting around the table. Everyone that's associated with the supported person is sitting around the table. Everybody is having a discussion. Everybody is contributing. Everybody that's there at the table is talking, and they're saying what they're going to do and what they're going to contribute, and how much help that the person who assumes the role of caregiver, how much support they're going to get from the rest of the family. And everybody is paying lip service to that. Everybody. But the reality tends to be is that normally the best person in that group that's sitting at the table, the one with the most humanity and unselfishness in them, they're normally the one that gets dropped with the responsibility of the whole caregiver responsibilities. Everybody pays lip service, but when it comes time for everything to hit the fan, those that pledged money, they won't show up. Those that pledge to help with the physical aspect of caregiving, they won't be able to be found. You look around and all the commitments that everybody that was sitting around the table said that they would do with the cleaning, with the cooking, and all of that, they can't be found. The only thing that will be able to be found is their excuses. And you won't see a lot of these individuals until it's time for probate. And you'll see them at probate with their hands out, looking for their cut. I know that sounds very, very cynical and cold, but that tends to be the reality. And we did have a situation where it was one way in different parts of the country, but it was more responsibility and humaneness among African Americans that lived in the South, because they tended to hold on to a lot of their values, and that has eroded. And now you see a similar situation in the North, as well as in the South, as well as in the East and the West Coasts, I guess. And this erosion is threatening the whole idea of transferring generational wealth to our children. Now, when you're faced with a caregiver situation, you normally have two primary decisions to make. You can go one route and institutionalize that individual and put them into various senior facilities and allow them to take over and do what is necessary to support all the supportive care. But what that winds up doing is that these institutions take the wealth from the supported person They take control of the bank accounts. They take control of the real estate. They take control, in some cases, of a lot of the personal property, because in some cases that has to be sold in order to pay the bill. So as a result of families not wanting to take care of the loved ones, I guess the price that we pay for that is that the generational wealth that our mothers and our fathers or our grandfathers and grandmothers, what they worked hard all their life to accumulate, to pass down, is taken. And in a lot of cases, this has really disrupted a lot of the economic continuity of African Americans as far as progress is concerned, because historically, when you look over what has happened, African Americans have lost a tremendous amount of land, and land is very, very crucial to people and to families. And in that context, we must begin to make decisions that allow for these wealth items to be transferred down to our children. And a lot of times you find a situation when the parent moves on, or they put them in a situation that the land is quickly sold by the people who inherit the land. And as a result, like I said, it erodes the economic base of a family, as well as of African Americans in general. So the other option that will help preserve and allow for this transfer of intergenerational wealth, the other option is home care. It's for us to do ourselves what our African ancestors did. In Africa, our ancestors didn't have nursing homes. Our ancestors didn't have senior facilities. When a person became elderly and old and unable to take care of themselves, then they were taken care of by the family. And that is what we need to consider today. Now, I'm not forming an opinion or passing judgment on those who have chosen to put their supporting care person in an institution. I'm not passing judgment on that. And please forgive me if it sounds like that I am. But at the same time, I think we need to really, really strongly consider the options that we have before we exercise these options. Now, if that case of putting your loved one in a senior facility or something like that is best for your situation, so be it. May Allah bless you. May Allah help you. May Allah help us all. But when you're dealing seriously with the idea of transferring generational wealth, then we have to move into an area where we're taking care of our own elderly and move forward from there. Okay, now with that being said, I'm going to move into an area and talk about an index. This is an index.
And Brother Ron, I just want to time check as well, because we only have a few minutes left. And I know I'm going to ask folks to also throw things in the chat if they have some questions for any of the presenters.
Yes, ma'am. Okay. Well, I'll speed up. So I'm going to talk a little bit faster. So there's an index that's used to predict the negative outcomes of caregiving situations and those who are exercising it and doing it. It's called the caregiving burden. Okay, when you're dealing with the caregiving burden. This is an index, and it deals with, number one, the care costs much energy when you're doing caregiving. Okay, that has to be factored in, and this affects the caregiver. The physical aspect of moving a person physically, and you tend to be doing this by yourself. So there's a tremendous amount of energy that goes into it. There's also, number two, a element called the desire for recovery, where when the caregiver is giving out the care, they psychologically are wrestling in their mind with a couple of things. And one of the things is this desire for recovery. And that plays a role in the psychological fatigue of the caregiver. Okay, and number three, there's too little time for your own interests. That goes out the window now, where you did have time to sit, read a nice book, listen to a little Coltrane, little Charlie Parker. Well, that goes out the window now. You don't have time to do all that. All you have time to do is to be a caregiver. Okay, and then number four, the thing that they wrestle with is this sadness over the fate of the supported person. They realize what the end game is. They realize what is coming down the road, but they still are wrestling and in some cases actually grieving while the person is still alive because they know what the outcome is. Okay, so negative outcomes are often not determined by the specifics of the caregiving situation itself, but by the reaction and the response of the caregiver. The term caregiver burden refers to the high level of stress that some caregivers may feel in response to the situation. Now, normally, caregivers themselves start to experience a lot of physical and mental issues that has to be addressed later on in therapy and whatnot. And one of the things that the therapist will do when they call in the caregiver is to ask also for the spouse to show up, because a lot of times what's overlooked when you talk about caregiver burnout is that you also have caregiving spouses caregiver burnout. A lot of times when this situation happens and the wife is drawn in to these caregiving situations, that what happens to the spouse is that the spouse is sort of feels like they're ambushed because there's a situation, maybe the supported person is on one side of town and the caregiver lives on the other side of town. And once the situation moves from a few minutes or a few hours to maybe 24-hour care, then you have a situation where after the wife, and I'll use the wife in this sense because primarily that's who the caregivers are, but once the wife performs the caregiving action, it's late at night, and the husband doesn't want the wife to be traveling back across town in the middle of the night. It's too dangerous. So as a result, the husband finds himself in a big old house and in a big old bed, and he's all by himself. And it's over not just days, but over months, and in some cases, years. And this is something that can create a lot of angst in the husband. He tends to feel some feelings of abandonment. So brothers have to be prepared for this. You have your wife out on the other side of town doing the caregiver situation, and she's cooking and cleaning at that house. Well, you can't expect her to come home and cook and clean it at her own house. It's not going to happen. So brothers are hit with this reality that either I'm going to sit here in this filth, or either I'm going to get up and start cleaning myself. And that's normally what happens. The husband feels gets in a situation where he has to cook, he has to clean, he has to do laundry, and he has to do the dusting and all of that he was accustomed to somebody else doing, in addition to the work and responsibilities that he had in the beginning with lawn care. So all of this falls on the husband, and normally it's the type of husband that is not used to that, but now he's used to it. So he has to have a very good, strong understanding of his deen, and keep in mind that when you are cooking, when you are cleaning, when you are supporting your wife while she's doing this, and while you are waking up in the middle of the night and there's nobody there but you, that you are actually operating in the sunnah, and you will be blessed with that. But it's going to be hard, it's going to be difficult, and it's going to be a trial. And you have to keep in mind that trials are designed to purify us, and you can tell whether or not it's a trial or a punishment. And I'm gonna close with this. You can tell whether or not it's a trial or a punishment is if it brings you closer to Allah, it's a trial. If it drives you away from this thing, then that was a punishment. So I'm gonna stop right there. I'm not gonna take up too much more time than that. I'll turn it back over to Dr. Ramadan. Assalamu
Walaikum assalam. Alhamdulillah. Thank you all. What a breadth and wealth of information. I know that there's a lot of folks online that may have questions. And I know that everyone knows how to get in contact with Imam Ramadan. And so I'll thank you all. And if you all have time afterwards, I'll leave the room open if folks want to have conversations. And I'll turn the recording off. But on behalf of Mesh Al Taqwa, I thank the Muslim Health Consortium, and more specifically, you, Brother Ron, you, Sister Sharon, and of course, Imam Ramadan for today's topic.
Thank you.
Thank you. And thank you for sharing the link, Sister Aisha, in the chat.